It's American Heart Month, and you are going to see a lot of talk about heart disease everywhere. But what does heart health really mean when you're living with an autoimmune condition like Sjogren's disease? It is about so much more than your weight or what you eat. Hi, everyone, and welcome back. My name is Dr. Kara Wada, quadruple board certified allergy, immunology, lifestyle medicine doctor, and Sjogren's patient. And if you're new here, welcome to our series on Sjogren's and heart health. If you're returning from last week, thank you for coming back. And if you missed it, well, make sure to tune in after watching this one. Now, last week, we talked all about the silent cardiovascular risk that comes along with Sjogren's disease, how the chronic systemic inflammation in our bodies affects our heart, our blood vessels in ways that standard guidelines often miss. And if you haven't seen that video yet, I'll link it in the cards and in the description below because it really sets the foundation for what we're going to talk about today. Now, after that first video, I got so many messages and comments from people asking, okay, Dr. Kara, I get it, there's a risk, but what do I actually need to be tracking? What numbers should I be paying attention to? And what should I be asking my doctor to check? And those are perfect questions because knowledge without action is just interesting information. What we need is a practical roadmap. So today we're going to cut through all the noise you'll see through American Heart Month, all the general advice that doesn't always quite fit our picture. And we're going to talk about the 7 key numbers that truly give you a comprehensive, holistic picture of your cardiovascular health, framed specifically for those of us living in autoimmune bodies. Before we jump into the specific numbers, I want to frame this properly. When I talk about these 7 numbers, I'm not saying you need to obsess over every single one of them all the time. Frankly, that's not sustainable and it's not healthy. That's going to throw your stress through the roof. But what I am saying is that these 7 markers, when taken together, give us a more complete picture. And they help us connect the dots between our Sjogren's, lifestyle, overall health, and our true cardiovascular risk. They allow us to be a little more proactive rather than reactive. And for each number I'm going to share, I'll explain what it is, why it's particularly important in the context of Sjogren's, and what a good or optimal number might look like, with the caveat that these ranges can vary pretty dramatically based on your individual circumstances. Now, remember, this is all about education. This is not specific medical advice, and I'm a doctor, but not your doctor in this YouTube context. The first number we need to think about and focus on, not surprisingly, is our blood pressure. And this often is called your silent messenger. Blood pressure measures the force of blood pushing against the walls of your arteries as your heart pumps. And we measure it with 2 numbers, systolic, the top number, and diastolic, the bottom number. Now, why is this particularly important for those of us with Sjogren's? Well, chronic inflammation can cause stiffness in our blood vessels, and they may lose some of their natural elasticity over time. When your blood vessels are stiffer, it's harder for blood to flow more smoothly, and that can lead to elevated blood pressure. High blood pressure, called hypertension, often has no symptoms, which is why it's often termed the silent killer, but it significantly increases your risk for heart attack, stroke, and heart failure over time. Here's what I want you to do. Don't just rely on the one reading you get at your doctor's office. Many of us experience what we call white coat hypertension, meaning our blood pressure may go up just from the stress of a medical appointment, especially when many of us have experienced some medical gaslighting along the way. So tracking it at home, ideally at the same time of day, gives you a much more accurate picture of what's truly happening in your body day to day. Optimal blood pressure is generally considered to be less than 120, the top number, systolic, over 80 being the high end of normal on the bottom number. But you want to talk with your doctor specifically about what target is right for you because those targets are a little different depending on other underlying health conditions, diabetes, kidney disease, already known heart disease, etc. Now, the second number that we need to think about are our lipids. That's your cholesterol and specifically your triglycerides too. Most doctors will focus pretty heavily on the bad cholesterol, aka low LDL, and that is very important. But for those of us with autoimmune diseases, that's just part of the story. We also want to look at our HDL. That's the good cholesterol, and it helps remove the bad cholesterol from your arteries. We also want to look at triglycerides, which are a type of fat in our blood. And we want to look at the ratios, specifically your triglyceride to HDL ratio. And the reason this matters is because this can be a powerful indicator of inflammation and insulin resistance, even when your LDL cholesterol looks totally normal. In an ideal world, your triglycerides should be under 150 milligrams per deciliter, and your HDL ideally should be above 50 milligrams per deciliter for women. But again, we want to look at the whole picture and these ratios, not just in isolation. When inflammation is driving your cholesterol abnormalities or your lipid abnormalities, which can happen with Sjogren's, we need to address that root cause, not just the cholesterol number itself. So we'll often talk more about this in the next couple of weeks when we discuss statins and other treatment options along the way. Number 3, it's actually 2 related numbers: your blood sugar markers and, if possible, your insulin level. Specifically, I want you to know your hemoglobin A1C. This is often shorthand to HbA1c or just A1C. And this is a blood test that gives you a 3-month average of your blood sugar levels. It's the gold standard for assessing long-term blood sugar control. Why is this crucial for us? Because inflammation and insulin resistance are best friends. They fuel each other in a vicious cycle. Often also, if we're on prednisone or other corticosteroids, this can drive further issues with insulin resistance and blood sugar abnormalities. Chronic inflammation also makes your cells less responsive to insulin. And when your cells are resistant to insulin, your pancreas has to pump out more and more insulin just to get the job done, which creates more inflammation. It's a vicious feedback loop. This matters for your heart because insulin resistance is a major driver of cardiovascular disease, contributes to high blood pressure, abnormal cholesterol, increased clotting risk, damage to blood vessels, and it's actually been linked to dementia and memory issues, in particular Alzheimer's disease. The beautiful thing about checking your A1C and your fasting insulin is they give us a clue about metabolic stress long before type 2 diabetes ever develops. An A1C below 5.7 is considered normal, but often we'll like to see it below 5.5% for more optimal health. And if your doctor is willing or able to check a fasting insulin level, ideally we'd love to see that below 10 micro international units per ml, ideally even lower. These numbers let us intervene early with diet, exercise, other lifestyle changes before things progress. Number 4 might surprise you. It's your waist circumference. This is more important than that number on your bathroom scale. And here's why. Where you carry your weight matters more than how much you weigh. Excess fat around the midsection, which we call visceral or abdominal fat, is metabolically active. It's not just sitting there passively. It's producing inflammatory cytokines, chemicals that directly contribute to your body's overall inflammatory burden. This type of fat is also associated with insulin resistance, high blood pressure, abnormal cholesterol, all of which increase cardiovascular risk. To measure your waist circumference, you'd want to take a tape measure and measure around your waist at the level of your belly button. For women, we would love to see this measurement below 35 inches for reduced cardiovascular risk. And for men, that number is 40 inches. Again, this is a much more meaningful number than that weight on the scale, especially for those of us dealing with chronic inflammation and autoimmune disease. Number 5, it's not a lab test, but it's absolutely critical, and that's your hours of quality sleep. I cannot overstate how important sleep is for managing inflammation and cardiovascular health. Sleep is when your body repairs. It's when you detoxify, when you consolidate memories, when your immune system recalibrates. And poor sleep, whether it's sleeping less than 7 hours a night or having poor quality sleep due to sleep apnea, chronic pain, perimenopause, a sick kid, is directly linked to increased levels of inflammatory markers in your blood. It's also linked to higher blood pressure, weight gain, especially around the middle, insulin resistance, and increased risk of heart disease. For those of us with Sjogren's, sleep is often already disrupted. Unfortunately, this comes along often with the neurologic issues that play in part with Sjogren's. If you're waking up frequently also because your mouth is dry or your eyes are really irritated, maybe you have a lot of body pain, overlapping sleep apnea, all these things add up. This is why I consider consistent quality sleep, aiming for 7 to 9 hours per night, one of the most powerful anti-inflammatory tools we have. It's foundational, and it's really important for us to work together, as I'm working with my patients, to figure out ways to help them optimize that. And if you're struggling with sleep, it's something that absolutely needs to be addressed with your healthcare team. It's not a luxury. This is a medical necessity. All right, we got 2 left. I'm wondering if you can guess what they are. Number 6 is where we look directly at the gasoline in your system, your inflammatory markers. And the most important one I want you to know about is called high sensitivity C-reactive protein. Also see it as hs-CRP. Now, CRP is a protein that your liver produces in response to inflammation. When there's inflammation anywhere in your body, that CRP level may go up. The high sensitivity version of this test is more precise and can detect even low levels of chronic inflammation. This is a valuable test for us because it gives us a direct measurement of that systemic inflammation. It's not just inferring inflammation from other markers, it's actually measuring the inflammation itself. And studies have shown that elevated high sensitivity CRP is an independent predictor of cardiovascular events, i.e. heart attacks, strokes, etc. That means even if your cholesterol and your blood pressure look great, if your high sensitivity CRP is elevated, you're still at increased risk. For optimal cardiovascular health, we would love to see that high sensitivity CRP below 1 milligram per liter. Between 1 and 3 is considered moderate risk, and above 3 is high risk. But here's the thing. With active Sjogren's or other autoimmune conditions, your high sensitivity CRP may naturally run higher. And that's why it can be important to track these trends over time and work on bringing it down through lifestyle interventions and proper management of your autoimmune disease with your healthcare team. This is a pretty simple blood test that you could talk with your doctor about and ask if they might be willing to add it to your next lab panel. Now, finally, we've made it to number 7, and that is heart rate variability, or HRV. Now, this is a newer metric that many people may not have heard of at this point, but it's incredibly valuable. HRV measures the variation in time between our heartbeat. Now, you might think your heartbeat beats at a steady rhythm, like a metronome, but it actually doesn't, and that's a good thing. HRV gives us a window into our autonomic nervous system. This is the part that controls unconscious functions like breathing, digestion, and heart rate. A higher HRV suggests your body is more resilient and can shift more easily between fight or flight mode and rest and digest state. It means you're more adaptable. A lower HRV is linked to chronic stress, chronic inflammation, poor sleep, and increased cardiovascular risk. It can suggest your body's stuck in a more stressed state and has less capacity to recover. You can track HRV with many smartwatches and fitness trackers now. And this is not a perfect tool, and it should be individualized over time within that person because there is a genetic component to our set point and where our HRV is. Those of us, like myself, who live with dysautonomia may also see generally lower levels of HRV. There also is no universal good number for HRV. Again, varies by age, our individual baseline, which has some genetic component. The dysautonomia can play into that too. Generally speaking, higher is better. We want to try to see a trend upward over time as we are implementing healthy lifestyle changes. Now, those are your 7 numbers: blood pressure, lipids, blood sugar and insulin, waist circumference, sleep, high sensitivity CRP, and HRV. When we look at these 7 markers together, we get that holistic, comprehensive view of your cardiovascular health. We're not looking at just one piece of the puzzle, we're seeing the whole picture. And this allows us to truly connect the dots between your Sjogren's, your daily lifestyle, and your real individualized cardiovascular risk. This empowers you to have a very different conversation with your healthcare team. Instead of just, my cholesterol is a little high, you can say, my cholesterol is slightly elevated, but my CRP is also elevated, my HRV is low, and I'm only sleeping 5 hours a night. My waist circumference has increased. Can we talk about an integrated plan to address all of this? You are the CEO of your health. Knowing your numbers is the first step to taking charge of your health journey and your heart health journey, especially when you're living with a complex systemic autoimmune condition like Sjogren's disease. If you want help turning these 7 numbers into something you actually use, here are a few ways I can support you beyond this video. Number 1, you can come join us in the free community. Come hang out in the Stronger with Sjogren's Facebook group. It's a calm, moderated space where we talk about labs and heart health symptoms and how people are bringing this to their doctors in real life. Not medical advice, but a nice support community Link is in the description below. You can also sign up to get reminders and deeper resources as we go through this cardiometabolic series. You can join my newsletter. That link's below too. And that's where I'll share checklists, scripts for talking to your clinicians, and updates like upcoming events, including our 5th annual virtual Sjogren Summit is coming this summer. You already know that you want a structured support for 12 months around movement, nervous system health, and long-term risk reduction alongside your medical care. You can learn more about the Stronger with Sjogren's program at the link in the description. Next week, we're going to talk about something that may surprise you, the connection between your allergies and heart health. Yes, allergies and your heart. It's a connection most people don't know about, and it's incredibly relevant as we're getting ever closer to allergy season. So make sure you're subscribed. You've hit the bell icon so you don't miss. And if this video was helpful, please give it a thumbs up and drop a comment below. Which of these 7 numbers surprised you the most? Which one do you want to start tracking first? Thank you so much for being here. I'm Dr. Wada, and until next time, take care.